Hi, my name is Alan Tsaur. I'm from Maryland, United States. It's an honor to speak here today at the 2022 Jing Fang International Conference. Today, I want to contribute a difficult case study where I really struggle in the clinic, and hopefully we can draw some useful lessons from this case. A little bit background about myself. I received my doctoral degree from MUIH and currently serve as a DAON faculty at ACCHS and Yale University. I first learned about Professor Huang Wang's methodology in 2015. So in comparison to all the distinguished teachers, peers, and senior practitioners here, I'm really just a novice. If anything, I just see it as my personal fortune to be a part of Professor Huang Wang's outstanding team to work on the most recent clinical manual. Today, I'm going to talk about a recent case that really baffled me in the clinic. It is a 48-year-old female patient with short hair, round face, round and expressive eyes. And she is prone to insomnia, stress, emotional swings, and also she has severe allergy. And when she first came in, she had a wide array of issues. So she had insomnia, glaucoma, cough, phlegm, pain and tension everywhere in multiple joints. And the one that really stood out were the cold pain and cold sensation in her lower limbs. And it was to a degree that it was as though the cold wind was venting out at all time, constantly. And she also had cold sensation that sometimes it reaches as high as the middle of her thigh. So it was clearly a case of SNE tongue presentation, and because of the cold reversal. And so I took her pulse. The pulse was quite chaotic with different quality all over the place, but overall it was deep and vacuous. And tongue likewise was pale, slightly swollen, wet, and with teeth mark. Abdomen was soft and otherwise unremarkable. There was nothing in the trachea zone region. But when I pressed on deeply in REN 10, REN 12, there was some tension and tenderness. And also she has edema in her ankles on both sides. So initially I treated her only with acupuncture because when she first came in, she really wanted to deal with pain in all her joints. But at the same time, since she had edema and also clear sign of yang deficiency, so I also supplement some other points like this, the worst three impaired from the master tone to supplement her a little bit more on that regard. And later on, I also added in herbs because I feel like I wanted to be able to sustain her treatment better. So when she first came in, I only treated her with acupuncture. I was able to manage most of her symptoms, but if she missed one treatment, then symptoms tend to come back. So in December, I decided to include herb into her treatment regimen. And that was a success. And we were able to stretch out her treatment from 2 times a week up to once every 2-3 weeks. I had to stop seeing her in March 2020 because that's when pandemic reached the US and it shut down my clinic. We keep in touch and she was doing okay. And when summer of 2021 came along and I reopened my clinic and she resumed her treatments. And we continued with acupuncture and herbs. And she was getting better. By September, I decided to treat her mostly with herbs. Sometimes I still do needle from time to time, but mostly treated with herbs. And by the end of that year, she was mostly symptom-free. The cold pain was still there, but it was quite mild. So I discharged her in October 30th, 2021, because I feel like she was doing all right. She doesn't need medical intervention anymore. And this was the formula I gave her as I discharged her in October 30th last year. This was a Guizhitang modification. It's not canonical, but I feel like this would be a good choice for her to be taken over a long period of time. So it's basically Guizhitang with young herbs like 肉桂附子干姜, with some blood herb with 黄金炙甘草, and also 川芎, and as well as baizhu to make sure her spleen is doing good work. And she took this format for about a month and we keep in touch, and she was doing quite well that winter. She didn't have much complaint of joint pain or other allergy that winter. That was until May 5th this year. So she came in with severe allergy symptoms. So she has symptoms in almost every single one of her sensory orifice. So the eyes, nose, ears, mouth, tongue, throat, everywhere was hurting. And this was possibly due to the overlapping seasonal allergy with both grass and oak, both of which she has severe allergy towards. And it was so bad that she needed to wear a gas mask all day long. So I decided to give her a formula similar to what I gave her prior that she seemed to do well on. So this is almost like a chaihu guizhitang. So from her previous formula, I added chaihu, cangzhu, hovu, and fulin. Cangzhu, hovu, and fulin should be straightforward, just trying to remove dampness, especially cold damp. And at the same time, I added chaihu in order to try to open up her sensory orifice. And so this is like a chaihu guizhitang modification, but I didn't add banxia because fuzi is in it. I didn't add huangqin because she had really bad reaction towards cold earths prior. So if I could avoid it, I would not use it. And I didn't add ren because there was the presence of dampness there. So I didn't want to do it. So she came back on 14th of May. So 1 week later, most symptoms disappeared. And she no longer needed to wear gas masks, but she still wore face mask just for caution. And cold pain was still the same. And well, one thing that was troubling was that she thought she was good after 4 or 5 days, and she stopped taking herbs, and the symptoms came right back 1 day later. So then for the next 3-4 weeks, she would come in 4 times, almost weekly, and every single time I gave her a different modification because I was trying to crack that case, because why would the symptom keep coming back? So each time she would have a different symptom, I would add in new herbs, and I would even consider adding in something like yupimengsan in order to, because I was thinking more like this is a Wei Qi issue. I want to keep the allergen out from her. And at one point I added up to 16 ingredients, but the result was always the same. She was doing well on herbs, but as soon as she stopped, symptoms all came right back. And what was more troubling on the June 6th, that the cold reversal and the cold pain in the joints were getting a lot more severe. And it was at that time I noticed that things were not going towards the right direction. And also she was generating a lot of new heat signs and symptoms, possibly due to a few herbs I added. And it was during that time I really need to stop and think, is that what's really going on? And I mean, I was really successful at suppressing her disease symptoms, but they can keep coming back. And that means I was not really treating her. So what was I doing, and what did I miss? So during a time, what was really troubling was that why did it keep coming back? And the other thing was, why did the cold reversal getting worse? So during the time, I could see the cold reversal was getting worse and worse, and I increased the dosage of fuzi, and I even added in a little bit of uto at one point, but it was getting worse. And on top of that, she was having a lot of heat signs on her upper body. So she was now presenting a heat above, cold below presentation. But at the time, it was that it didn't make sense. For all the herbs I added, they were supposed to be able to treat that symptom, but why didn't work? So as I sit there puzzled and confused, my patient told me something quite interesting. She said that when she was treated by her previous acupuncturist years ago, he was able to give her relief from seasonal allergy for up to 2 years. And the way he did it was she had intensive treatment for 2 weeks straight. And he would just use very simple point selection. And in one treatment, this is the point he used. He used Du 14, bladder 60, stomach 36, and Y Sanguan. Y Sanguan is a master point. So just think of it as GB 34.5, GB 36, GB 39. So it's 3 points along the gallbladder channel. So it really invigorates the gallbladder channel quite well. So when I look at it, it's like this practitioner was a master. He really knew what he was doing. So when he used those points, Du 14 and bladder 60 open out the neck region, which open out the Wei Qi. And then you have Y Sanguan to strongly invigorate gallbladder. So it's like treating a stomach disease. And then you have stomach 36 to take care of the reinforcing Wei Qi, because stomach is a source and foundation of the Wei Qi. So this person really knew what he was doing. And so that was very interesting because he was not doing 100 counts of moxide on her Ren 4 or somewhere. He was just regulating her with what she had, and she was able to achieve the relief up to 2 years. That's incredible. So with that in mind, I re-diagnosed her, and her pulse was tense and slightly deep in her Guan position. All the positions were unremarkable. Tone was pretty much the same. The only difference was there was a red tip now. And abdomen, the same, soft and pretty much nothing except that deep tension around Ren 10 and Ren 12. And appetite was okay. And actually she said it was quite well, but the only weird thing was her stools. Her stools was very loose, and it was almost on the verge of diarrhea. So with that in mind, I could come up with a new set of hypotheses. First, it's not a yang reversal pattern. So it's not a Sini-san pattern because there was nothing in the Chaihu area, and also there was no wire pulse, even though she keep having a recurring symptom. So Chaihu might not be the right herbs for her in this case. And also, her diarrhea or loose stool suggests that there could be cold damp in her middle jaw. That could be what's causing all the trouble in her chin mechanism, causing this heat above, cold below presentation. So in order to resolve that, we really need to work on her middle jaw, just like her previous practitioner did. We should regulate her, not giving her more. And perhaps that could solve her cold reversal. And as I was thinking about that, so when you have heat above, one really vital thing you need to do is to descend the yang qi to the below. And what is the best herb for doing that? Banxia. And as I was thinking about it, I took a look at her. I remember I was like, she does have very round face, and she does have very round eyes, and her eyes were sparkling and look over the place all the time. I was like, that is the definition of a banxia eyes. But for her case, can I really use banxia because I really want to use fuzi, because her limbs were cold, and it was cold to a degree it reached the thigh. I have no choice but to use fuzi for her case. But can I use that in concert to banxia? And so in that case, I went for it because in her case, I feel like I had no choice. But in her case, I decided to use a banxia hopotang as a base formula. And it's really a combination of banxia hopotang with banxia sanjitang plus sinitang. So sinitang we know is fuzi, ganjiang, and gancao. So everyone knows it, so I don't need to explain it. But banxia sanjitang is a rarely used formula is banxia rougui gancao. So it's used to treat Shaoyin throat pain. And she does have strong throat pain, and actually throat pain is actually her worst symptom. And so that's why I really want to use that formula. So it was a combination of those three formulas plus the addition of Changzhu and Buguji, and in order to make sure I can get rid of that cold damp in the middle burner. And she took the formula for 1 week, and she reported back a week later on June 29th. She said that all symptoms disappear. But that was not surprising because that always happened. But what was most interesting was her heat sign also disappeared, and also her reversal code was reduced drastically. So 1 week earlier, it was up to the thigh, but 1 week later, it was down to her right ankle only, and it was much mild. So I saw it as a success. I gave her another dose, 1 week dose, and she hasn't come back. And I just checked out with her today, and she was still doing quite all right today, as of today on July 27th, 3 weeks after she ran out of herbs. So this case, at this moment, I somewhat consider it as a success due to the drastic reduction of her symptom, even though I cannot really be sure if it's because, well, maybe the seasonal allergy ended because it's the end of June and early July. Maybe the allergy or seasonal allergy ended. But still, her cold pain, reduction in her cold pain was something that I could have never achieved even in a prior treatment. So I really think we did something good in this round of treatment. So here's something I really want to discuss. First off, is suppressing the disease sign and symptom good enough? So I was really successful at suppressing her symptoms. And so whenever she was being treated, she was doing all right. But whenever she was off herbs, everything came back. So was it good enough to just suppress the symptom? To my view, it wasn't good enough because it means I was only suppressing the symptom and I wasn't really treating her. And this is to a second point. Professor Huang always talks about when we treat, we need to consider 3 things: formula, disease, constitution, 方病人. So when a patient comes in, they expect us to take care of their qi complaint. So most of the time, we really focus keenly on the disease symptom, which is what I did on this case. And certainly that was a mistake. It was my oversight. Because of that, I ignored her Banxia presentation for the longest time until that awakening moment on June 6th when I became curious again and trying to figure out what was going on with her. And it was also around that time I realized, oh, I really need to take care of that middle burner because that could have been causing that cold below, heat above presentation. That was really screaming at me at times, just telling me, like, hey, Ellen, take a step back, go back to step 1 and re-diagnose her. You're definitely missing something. So how do we determine where to start our treatment? How do we develop that confidence to say, when this patient comes in and we can just say, okay, here we go, let me treat your constitution and everything will resolve on its own? And where do we find that balance? Because patients, they don't come here to talk about XYZ and feel better about themselves. They want their issues resolved. How do we give them to that effectively? And in this case, I focus on the disease symptom the whole time. And that was clearly a mistake. It was only after I addressed the constitution that everything else resolved. And so where do we find that balance? Now, that was my second question. I don't think there is a good answer for that. This really asks us for years, if not decades of practice in order to develop that confidence and learn that nuance in order to apply those ideas and thoughts in clinic. And this leads to the next point. When we are dealing with disease symptoms, it is extremely easy to add more herbs. Eyes, okay, just add those 2 herbs. Ears, add those 2 herbs. Oh, stomach, add those 2 herbs. So it's so easy to go up to 10, 12, 15, 20 ingredients, but it does not always work out. So, but on the reverse side, it's so hard to remove herbs because we're always so afraid that once we remove certain herbs, that we might not guarantee the effective outcome. And how do we develop that confidence to prescribe? For example, in this case, in the end, I gave her a big combination of 3 formula, well, two small formula plus Banxia Hopu Tang, plus 2 other herbs. Maybe I could have treated her with just Banxia Hopu Tang alone, or even just Banxia Sanji Tang, but I just did not have the confidence to do so. And how do we know when we can do that with very, very simple formula? And I think that's really the epitome of the Jing Fang practitioner. As a definition of Jing Fang practitioner, we need to be very elegant in our treatment. We don't want to add in all the herbs, all the unnecessary parts, and we can just treat with very simple formula. And this definitely truly takes years of study, experiment, and learning in clinic so that one day we can really truly practice Jing Fang medicine as elegantly as we can as clinicians. And lastly, this experience really lead me to question whether we really want to abide by the concept of 18 clashes, 18反. In this case specifically, 乌头反半夏, 乌头 clashes with 半夏. Is that a really set rule that cannot be broken? In this case, it seems so, because maybe because she has a lot of cold damp. And so the overly drying nature of that combination seems to work quite well for her case. But can this be applied for other cases so that it really awaits more investigation? And hopefully this short presentation and this particular case really raised some question and discussion. And personally, I would say it is difficult cases like this, challenging cases like this that really makes me humble. And to put me back to square one and think everything over again, be a student again, with those curious eyes again to observe the world and find out what we can do best with them. So the study of Jing Fang really takes prudence, patience, and diligence. And to end this presentation, I cannot find any better phrase than what Professor Huang encouraged me all these years ago. 勤求古训. In English, diligently seek the wisdom from the ancient decrees. And perhaps that is the best way for us to develop ourselves to become not only better clinicians, but also better people. Thank you for having me. Hope you have a wonderful conference. Bye.